right, welcome. I'm here today with Jennifer Battle, an alum of the Graduate College of Social Work at the University of Houston. And Jennifer, thanks for joining us today. I'm going to turn it over to you and ask you to introduce yourself by telling us a little bit about when you graduated, what your current job is where you work, and tell us a little bit about what your job is like on a normal day pre-pandemic.
Awesome. Thanks, Alan. Glad to be here. I graduated from the University of Houston Graduate College of Social Work in 1998. And I currently serve as the Director of Access for the Harris Center for Mental Health and IDD, stands for Intellectual and Developmental Disabilities, which is a local mental health authority that is prescribed through our state to provide mental health and IDD services for people who might not normally be able to access those care through insurance issues or any of the other barriers that people typically have in place being able to access care. My history at the Harris Center, I've been there for 17 years. I've always worked in crisis services. So I kind of chuckled at your question about what's a normal day. A normal day in crisis services is pretty exciting. We're constantly having the opportunity to really think about things in a little bit of a different way and figure out how we're going to make sure that the most vulnerable in our community can access what they need under already difficult circumstances prior to the COVID situation, which does allow us to really think a little bit differently, I think, than folks who don't typically work in crisis. So we're used to thinking quickly, we're used to being flexible, we're used to delivering where there are no additional resources available to us, or delivering whenever the powers that be say, we'll get you more resources, but we don't know when they'll get there. Can you do things right away anyway? And the answer is usually yes.
So what are things like now? Is it different? I mean, it's always crisis, it sounds like, but it's
Right.
different now.
Sure. Well, it's different now because we are, the typical kinds of disasters that we face in our community are sort of localized, right? So we're really good at hurricanes. As a community, we know how to deal with that. We know how to help our staff. Whenever my programs, a lot of them are 24-hour programs anyway. So we're essential anyway. So whenever we're faced with a disaster, my team automatically knows that we keep working, and that we're here for the community, that the community needs us. We actually won a national award after Harvey for our ability to keep our program up and running. We had staff who were camped out at the crisis line for 5 days, providing continuous ongoing care, even in the midst of sort of community chaos. And we knew that we had staff that were impacted, and we knew as an organizational at the larger level of who at our agency was being impacted. So we could reach out and take care of people on an individual basis that are employees. We're always looking at how do we care for the clients, but also really want to take care of our employees. So what's sort of different with the COVID situation is we're still there, we're still 24/7, we're still essential, but it's not like a localized risk anymore. It's not like, oh, our client base is experiencing crisis and maybe we have a couple of people on staff who are impacted. I mean, it's everybody. Our staff is scared, the community's scared. So really trying to strike that balance between how do we live the justice that we want for our clients while still telling our staff that they also still have to come to work. We didn't have up until today. We actually flipped the switch on our remote telephone system for the crisis line. So my staff has still been coming to work every day. We did fix everything in our call center so that we were able to socially distance people. So we reset everyone, every other station. We've got, until we couldn't find them anymore, we had, tons of Clorox wipes and everything, so that in between every shift, we were making sure that people felt like the space was being clean. We worked with our facilities team to be more present and do more wipe downs of doors and things like that. So we just wanted to do everything we could so that the staff felt like and could see us making efforts to say, we know that you're our biggest asset. If our staff is not safe and well taken care of, then we can't take care of the community. And then in the middle of all this, we actually decided to stand up a specific support line just for COVID-19 and for mental health support specifically. So, and then on the 18th of March, we went live with a Harris County COVID-19 mental health support line that was available 24/7, so that anybody that needed a call just to kind of talk specifically about their fears, their anxieties, their concerns, they could.
What are you hearing? What are you hearing on those calls? What are people calling them?
People are frustrated about testing. That's like a huge issue. A lot of people come to us because they've been on the website of whatever their county is, and it'll say, oh, we've run out of tests for today, or check back again tomorrow, or your symptoms don't meet this criteria. And then at the very bottom of most pages, it'll say, and if you need mental health support, please call this number. And I think people do exactly what they do when they're in crisis, and they just look for every number that they can call. So a lot of people are calling us. And so what we've trained the staff to do is, and if the person is calling and saying, I need to know where I can go to get tested, then we'll say, you know what, we can definitely connect you to some resources. But in the meantime, it sounds like you're pretty nervous or agitated or upset or frustrated or overwhelmed, whatever it sounds like. Do you want to talk for a few minutes about what's going on? And then just giving people an opportunity to kind of vent it out. We're hearing from, interestingly enough, we're hearing from quite a few people who are worried about loved ones who are first responders. So they're worried that their mother, brother, sister, husband, son, daughter is working at a hospital or a Target or at the gas station or wherever. And they are worried that they're being exposed, that they don't have the right PPE, that they're going to bring that home to their families and put everybody else at risk. And so just a lot of fear and anxiety around their family's safety. We're getting a lot of just questions and concerns about people who are impacted financially. A lot of people that work in the gig economy, or that are, worked in restaurants or bars or other type of places, who are no longer having income, and they're starting to get worried about paying rent and paying bills. So we're working closely with our partners at 211, who keep really good lists of who is providing financial assistance in the community, and also helping get people connected to Texas Workforce Commission for disaster unemployment, if that's appropriate for them. So we've heard from, we had a call actually today from a 94-year-old lady who is worried about just her own understanding of what puts her at risk, and wanting, just had some general questions, which of course we're not providing any sort of medical support, but we were able to kind of pull up some information, because she wasn't comfortable with us sort of doing our typical, like, well, the Centers for Disease Control website says this, or the Department of State Health Services says this. So we kind of read her some things and tried to kind of help with some of her anxiety. A couple of days ago, we had a call from a 17-year-old who her dad had seen the number somewhere and had given her the number, because she was just nervous and anxious about school. She was worried about applying for college. She was worried about testing and grades and AP and all of this. So it's just been the gamut of, this particular crisis is interesting because it impacts everyone. So there is no sort of standard call that we're experiencing.
And they're just looking for someone to talk to, someone to help process. Mm-hmm. Someone.
Mm-hmm. Well, and if you think about it too, a lot of folks are doing exactly what they're supposed to do, which is socially distancing, staying at home, stay safe, stay home. For a lot of people, that could be stay safe, stay home, but you're by yourself. So it does feel isolating. Again, if you're kind of talking about technological disparities. If you're sort of a young hip person with lots of access to technology, then you may still be able to keep up with your friends and your family and your work, and you still feel connected to people. But if you're someone who doesn't have internet or doesn't have technology, doesn't know how to do or feel comfortable using all these things, then you literally can be very isolated. So this idea of not feeling like you can connect, when we're saying, we know it's not really safe for you to go to the senior center, and play bingo. It's not really safe for you to go to your house of worship right now. It's not really safe for you to go to the YMCA to work out. All of these things that people have always done because we told them these are the things that you need to do to stay not only physically healthy, but mentally healthy. We're now saying, whoa, we don't really want you to do those things because you could get sick, but they don't have another outlet.
Yeah, you brought up so many interesting points, particularly like in Houston. You mentioned Harvey. We know what crisis and disaster is like in Houston. We've been through it, but this particular crisis is just so different now because not just the fact that it's not localized, but the impact that this social distancing is having on everybody.
Mm-hmm.
I don't think we've ever experienced before,
Mm-hmm.
at least not that I can recall.
Well, I mean, and again, it's just so antithetical to everything that we talk about when we talk about mental health, right? So much about mental health is about connection. And when we talk specifically, like my area of expertise is really in suicide prevention. So when we really talk about suicide prevention work, it's always around connection and feeling like you're part of a larger system, feeling like you have meaning. So when we take people so far out of their routines and then we add all the additional stressors like finance and the schooling and education and the kids and the volatile relationships. When you put all of this in, it's just a very dangerous it's a very dangerous situation. And so again, like anything that we are able to do within our organization to be able to reach out and provide some buffer to this sense of isolation. We were already talking about before all of this COVID stuff. There's been so much conversation in the mental health and suicide prevention community around loneliness and this sort of epidemic of loneliness. And so I think that this is really making that harder on a lot of people. And I do have concerns about the same concerns I've always had, but just bigger. But I do have really like strong concerns about people who don't have technology, people who don't have the ability to, even people who don't have phones or that their phones, they have those very limited ones that only allow you to make emergency calls, that don't have, internet to even, watch something funny on TV. But if you really don't have TV, if you don't have access to internet, if you don't have these kind of distraction things that are so important that help you move away from fixating. I'm just really worried about people fixating on, the numbers and the deaths, as opposed to being able to step outside of that, at least for a little while. So, I'm really concerned about our folks who don't have stable housing. People who are out in the street, people who are marginally housed, right? Like, so they're kind of couch surfing. And the more that people are trying to socially distance, they may be limiting the number of people like, oh, I know you've been staying with me, but I really need you to not stay with me anymore. So we're hearing some of that. And there's nowhere for them to go, right? Because also our systems that are set up and designed as our shelters are not designed for people to be socially distant. So my hope is that all of these things that we as social workers have recognized for always, because that's what we do as social workers, are going to be things that now really get attention. The health disparities piece, access to care, all these things that we talk about will become part of our recovery plan moving forward as a nation. About what do we do? This is real. This is what the news that's just come out in the last day or two about the racial disparities for the impact of deaths from COVID. I mean, we're going to have hopefully really big conversations about that. again, those of us doing the work have been having those same conversations for years, right? We know about the comorbidity rates with poverty and diabetes and hypertension and all of this. But it feels like finally other people are having these conversations, people, policymakers, people with access. So I I'm hopeful that after we move over this horrible time that we're in now, we have a chance, sort of this opportunity to really kind of create some lasting systemic change.
I've been thinking about that a lot. I mean, you mentioned all of the crises like this tend to shine a light on these inequities in society, and I think even that happened in Harvard, but I think it's more so now in a lot of them. But I've been trying to think a lot about where we can look for opportunity. How can we expand our moral imaginations, and
Mm.
how can we, once we get past this pandemic, what can we do differently as a society so that the next time we experience a crisis like this, we don't see the same inequities? How would you like to see us change?
I think it's the social workers wish list, right? Like the social justice worker wish list. We need sustainable housing, safe housing. We need housing so that we don't end up where people are having to quadruple up in efficiency apartments, or because they can't afford anything else, or people who are having to live in quasi shelter environments because they don't have anywhere else to go. That by itself would be huge, right? We know that there's a housing crisis nationally. We absolutely know that there's one right here in our own city of Houston. So if we want to talk about how do you address so many of the things that we were talking about, I think a lot of that starts with housing. Because then once you get housing in place, then we can work on integrated care, right? Integrated care, physical care, mental health care being offered oftentimes at those housing facilities, right? If they have those services, but also offered at places like the Harris Center and some of our friends at the federally qualified health centers. We're all working together so that we're not making getting assistance onerous. It's so hard. It's so hard to be poor, and it's so hard to live in poverty because we make you go to like dozens of places to get the same care that a person with resources can go to like one place and get what they need. And I think that the more that, but again, I think it starts with housing. It starts with co-locating programs there for both physical health and mental health. I think technology is huge. We've had a lot of conversations in the past about technology in schools and having the right technologies in the classrooms. But I think this is going to be a huge conversation moving forward, because there's kids in school districts right here in our own backyards who are not doing any work because their schools don't have the technology or the Chromebooks or what have you to hand out to the kids. The kids don't have internet in their homes, so they can't even do this. And I mean, that is, well, I'd like to say shocking. It's not shocking because we know that that's happening. But for many people, that is new information. And so I think that depending on how long this lasts, it's unacceptable as a community to have a child not receiving any education for half of the school year because of lack of access to technology. So I think technology for the kids, but I also think technology and education and awareness for our seniors. I think that this social isolation thing is really I think that the illness is hitting our seniors disproportionately. And I think that the general social isolation is hitting our seniors disproportionately. And so I think that I'd love to really see us as a community get behind some initiatives to not make sure that just our little kids have laptops or tablets or what have you, but that also our seniors have those things so that they can stay connected for telehealth, right? For telehealth, telemedicine, telecare, as well as for connectivity to their friends and family and loved ones. Online exercise classes. We want our seniors to stay fit and healthy. So, it's helping them have community. So those are all the things that I would like us to see.
So last question, how would you say, what would you want the social work community to know in terms of how they can help? How they can help what you're doing or what the Harris Center is doing, or help in a more global sense, help our community?
I do think, kind of going back to what I mentioned before, is listen to the stories of the people that you serve. Listen to the positive stories. I mean, there's such a being social workers is the best, right? Like we are the receivers of gifts every day. Like the gift of the stories that our clients share with us is so powerful. I think sometimes we get really caught up in the things that are missing in our client stories, and the all the just huge gaps in care, and the holes in service that need to be filled. And I think sometimes we're so focused on the deficits that we oversee or overlook the really positive things. And I would really love for us to not only be keeping the list of here's what's missing and here's what needs to be improved, but also like here's where things are going really well. Here's how this situation, my client who I've been trying to get them to, work with me to do XYZ for the last year, and they never did it, like they did it. They did it because I provided them this new thing that we'd never talked about before. And I didn't even know to offer that. But now that I did, we're seeing success, really tracking those successes so that later we can go back and look at that and say, huh, what were when we talk about policy, we always talk about unintended consequences, right? So like, what were the positive unintended consequences that are going to come out of this that we may not be able to see right now because we're just so in crisis, right? Like we're in crisis mode, but later we were going to want to track that. So I think as social workers, we're in such a unique position in our community to hear those stories. I'm always shocked. I just love social media. And I love being on social media, and I love looking at people's stories who like clearly just have no idea what goes on outside of their neighborhood. Like they just, they're just living their life, and they're just, like, yeah, I'm at home with my kids and it's no big deal. And I'm so glad. Like, I don't want things to be bad for anybody, and I'm grateful for them. But like, they don't hear the stories that we hear. Like, they don't really know what we know. And so I always forget that. Like sometimes I forget that there's people that don't live in the place that social workers live in. And then I feel even more honored and gifted at hearing those stories. But that's also a responsibility for us. And those stories, those positive stories, are going to be just as impactful when we change legislation and we change systems and we push policy post-COVID as they are with the negative things, right? So we got to have the balance of both.
Well, that's a great way to end, because real change comes with policy change.
Yeah.
Thanks, Jennifer. I really appreciate you doing this. I think that idea of focusing on the positives and positive unintended consequences is a really good message. So thanks for being with us today.
Yeah.